and hello to the new joys and responsibilities of parenthood. We're going to share with you some important information to help you adjust to changing priorities and demands on your time. Let's get started as you and your newborn really get to know each other and establish a routine.
The information here is general in nature and not a substitute for the advice and medical care from your healthcare professional. If your pediatrician recommends different instructions that are specific for your baby, please follow your physician's advice. Your baby's follow-up appointment with the pediatrician usually comes 2 to 14 days after your discharge from the hospital, depending on how long you've been in the hospital, your baby's weight, and other factors. At that time, your pediatrician will track your baby's growth and development along with weight gain, jaundice, and feedings.
This is a bulb syringe and it's yours to take home. You will use it if your baby starts to choke, gag, or spit up. After using it, clean the bulb syringe with warm soapy water. You can also use it to suction your baby's nose if your baby is stuffy. Once you and the baby are home, family and friends want to visit you. But during the first few weeks, don't get overwhelmed by visitors. You also need to limit who handles the baby, especially other children. This will help keep your baby from getting sick. It's always a good idea to remind everyone to wash their hands thoroughly before touching the baby.
On average, a newborn baby weighs roughly 7.5 pounds. It's not unusual for an infant to lose 5 to 8% of their birth weight during the first few days of life before they begin to gain weight. Most babies regain their birth weight by the 10th day, double it by 6 months, and triple it by 1 year. Infant sleep patterns can cause new parents to see changes in their own sleeping schedule. Until 6 to 8 weeks of age, most babies wake up for a feeding every 2 to 3 hours during the day. At night, newborns will usually wake up every 3 to 4 hours to feed. Once your baby is above birth weight, you can usually let him sleep longer at night. Talk to your pediatrician about this. Each infant tends to set his or her own sleep pattern. You really can't do anything to change that, so you should rest when your baby sleeps. Most babies will begin sleeping through 1 or 2 nighttime feedings at 4 to 8 weeks of age.
Prevention is the best remedy for diaper rash. Change your baby's diaper as soon as possible after he or she wets or has a bowel movement. Apply a diaper rash cream or petroleum jelly after washing the baby's bottom with warm water. It's common for newborns to have a variety of harmless skin blemishes and rashes. Newborn milia or baby acne is caused by hormones and mimics teenage acne. Other babies may experience erythema toxicum or newborn rash. These are blotchy red areas on the skin. They usually resolve in a few days. You may also notice dry, peeling skin on your baby's scalp, hands, and feet. This is normal, and it's probably best to leave that alone because lotions tend to slow the elimination of dead skin. Your baby's first bath at home is a memorable experience. You will give your baby a sponge bath every 2 to 3 days until the umbilical cord falls off, and if you have a boy, the circumcision heals. Make sure you have all of your bath supplies ready to go before bath time begins. And remember, never leave your baby unattended. Using the corner of a washcloth, start cleaning your baby's eyes. Clean from the inner portion to the outer part. Use a different corner of the washcloth for the other eye. Use water to wash the baby's face. Be sure to clean around the nose and ears. Never insert a cotton swab into the nose or ears because this can cause damage, especially to the eardrum. For the rest of the body, use warm soapy water, cleaning every fold and crevice. A baby's skin can be sensitive, so don't use any type of baby powder. Other products such as shampoo, soap, and lotion should be fine. However, if a rash develops, call your pediatrician. Once you've rinsed the baby with clean water, then dry, dress, and wrap the infant in a blanket to prevent getting chilled. Don't cut your baby's fingernails for at least 2 weeks following delivery. If the fingernails are long and your baby is scratching his face, you can put socks on his hands to prevent this. Alternatively, you can use an emery board to file the nails. Remember to use clean water on the genitals. Baby girls may have some vaginal discharge. And be sure to wash from front to back so that stool is not wiped into the vagina. This will help prevent urinary tract infections. For a baby shampoo, wrap the infant in a towel and use the football hold. On the wet scalp, apply a little shampoo and wash, making sure to stimulate the entire scalp area. Then rinse with lukewarm water. If the baby develops cradle cap, contact your healthcare provider. Following the bath, swaddle the baby for warmth. Sometime between 1 to 4 weeks, the baby's umbilical cord should fall off on its own. According to your pediatrician's instructions, alcohol or clean warm water may be applied with a cotton swab or cotton ball 3 to 5 times a day. The cord will look more like a scab as it dries. Don't pull it off, let it fall off by itself. But if you do see a bad smelling yellow or green discharge or redness on the skin surrounding the umbilical cord, call your pediatrician. Continue with sponge baths until the cord falls off. Then you may give your baby a tub bath.
If you have a baby boy, the choice for circumcision is a personal one. If you're not sure what to do, talk to your healthcare provider about the procedure. There are different techniques used for circumcision. Your nurse will teach you how to care for the type of circumcision chosen for your son. Clean the penis with warm water for the first few days. The tip may look red and have a crusty yellow appearance in some areas. Do not try to wash the yellow substance because it's part of the healing process. But you should call your pediatrician if you notice